All right. So beyond giving birth, there are contributing factors to poor health within the Black community. Black Americans are more likely to live near polluting plants, toxic sites, and in rental housing with mold and other triggers because of racist housing laws established decades ago during segregation that were never fixed. Their asthma is often more severe and less likely to be controlled because of poor medical care and completely valid mistrust of doctors in the medical community. So, Black children born with subpar support grow up in a toxic environment due to racist policies designed to oppress them. They then develop asthma and are unable to treat it due to bias and distrust stemming from generations of mistreatment. And that leads to severe health deterioration, which leads to missing weeks of school, leaving them behind in schoolwork. And in turn, their parents have to take off. They're forced to miss work to take care of them, putting a strain on the family's finances. This cycle puts a damper on the bootstrap mentality that you often hear from some people, right? Pull yourself up by your bootstraps. How? So as these little ones grow up, about 56% of them will have high blood pressure compared to 48% of white people. 3 in 4 African Americans are likely to develop the disorder by age 55. The same Black communities that experienced discriminatory housing policies more than 60 years ago are at a greater risk of heart disease and other related risk factors today. Residents of those neighborhoods also have less access to public transportation and health insurance. They also see lower life expectancies and higher incidence of chronic diseases that are risk factors for poor outcomes for COVID-19, including high blood pressure. Hard to pull yourself up when your bootstraps are cut and your boots are cemented in place. So, with all of this physical trauma, we haven't even talked about mental health and how it's compounding on racist infrastructure, on top of physical trauma, on top of the racist treatment. Self-harm, suicide, and other behaviors stemming from untreated mental trauma often go unchecked in Black communities. There's a stat that I cannot wrap my head around. I've read it so many times. I just can't imagine growing up like this. Black teenagers report experiencing an average of 5 instances of racial discrimination per day. It's just built into the fabric of their experience.
Well, it's built
Does
into
it have
the
to be
fabric of our society.
Yeah, well, that's what I mean, right? Exactly. Better way of putting it. The experience they're meant to have in our society. So, about 53% of Black youth experience moderate to severe symptoms of depression, and about 20% say they were exposed to racial trauma often or very often in their life. Research is examining the effect of this mental stress on high blood pressure rates in Black communities, psychological stress, including discrimination or navigating racism, and its ensuing effects could be a precursor to high blood pressure.